My name is Dr. Rawn Salenger, and I serve as the Chief of Cardiac Surgery. Heart valve disease is a broad topic, and what causes heart valve disease can be different for each valve. I'm going to concentrate mostly on aortic valves and mitral valves, which are the most common valves we see with problems. And particularly, I'm going to talk about mitral valves, which is what I specialize in. For mitral valves, the most common disease is something called myxomatous degeneration. And this is basically a degeneration or a loosening of the tissue of the mitral valve leaflets, which causes them to become floppy and then prone to rupturing their support and leaking. For the aortic valve, the most common thing is for calcium to deposit on the leaflets and cause the valve to be restricted. The classic symptom of heart valve disease is shortness of breath. But for many patients, they may have a severely leaking valve or a severely restricted valve and have no symptoms. And it's important for these patients also to have a discussion with a heart valve surgeon. Many of those patients, their valve disease is discovered by their primary care doctor or their cardiologist hearing a heart murmur and then a subsequent echocardiogram. For other patients that I talk to, they really just feel like they're getting tired progressively. They can't get through the day. They can't exercise anymore, and just a lack of energy. I think the important point is to know your body, and if you are having progressive symptoms that aren't going away, go see your doctor and get checked out. When you come to St. Joe's for your valve care, we take a repair first strategy. We believe restoring the patient's native valve to fully functioning is better for long-term outcome and less short-term complications. Particularly with the mitral valve, we'll always take a repair first strategy, and replacement is a backup to that. For patients that have what we call primary regurgitation, meaning their valves leaking because there's something wrong with the leaflets, they're almost all going to get a repair. For patients that have something else that's affecting the mitral valve, like infection or a heart attack or the heart has dilated, sometimes those patients are better off with a replacement. So when you come to St. Joe's for your valve surgery, there's two basic options, either surgical repair or what we call a transcatheter repair. And a heart team meets to talk about those options on each patient. And if you need a surgical repair, you can either have a conventional open heart surgery or potentially, if you're an isolated valve, maybe a candidate for minimally invasive valve surgery. So we review each case as a group, and then we work with the patient and the family to help guide them to make the decision that we think will work best for that particular patient. So the mitral clip procedure is a relatively new procedure that's been a big innovation in mitral care. It's a procedure that's done entirely through the leg vein, and we're able to thread a hollow tube up to the mitral valve and actually put clips on the valve where the mitral valve is leaking and bring the edges together. And with that, we're able to decrease the leakage from a severe leakage often to just down to mild. And this has been a great treatment, particularly for patients who are at high risk for surgery or very elderly patients. So the mitral clip has allowed us to treat even high risk and frail patients and allow them to improve their symptoms and get back to a better quality of life without having to undergo a big open heart surgery. So if a patient at St. Joe's needs a surgical approach, they're not really a candidate for a transcatheter approach to their valve, and they just need an isolated valve surgery, then they're a potential candidate for a minimally invasive approach, often a small incision on the right side. The benefit of that approach for patients is that they often spend less time in the hospital, and particularly after about 3 weeks, there's a quicker return to normal activities. And that fits in well with our enhanced recovery after surgery philosophy here, and we try to decrease the trauma of the entire surgical journey for the patients and optimize their recovery and get them back to full functioning as quickly as possible. And we find minimally invasive valve surgery helps us do that. In the end, they also ultimately have smaller incisions and it's more cosmetic. And I think this can also be important in some patients recovering psychologically and feeling like they're well healed and back to being fully functional. When we see our patients back in the office 3 or 4 weeks after surgery, they feel like their life has been given back to them, like the governor's been taken off their engine, and they're able to do things that they haven't been able to do in years. And it's just a very gratifying experience for everybody. I think St. Joe's is the best place to come for heart care, and specifically cardiac surgery, for two reasons: expertise and teamwork. We have the doctors who have the knowledge and experience to treat even the most complicated cardiac problems, and we all work together as a team to get the job done for the patient. I just love coming in every day and going to the operating room, working with my team, and then seeing the patient post-op day one, and they tell me I already feel better. Seeing them back in the office with their families, and they're so happy, their family's so happy. It's like they have their loved one back that they haven't seen in a year, and it's just beautiful.